Let's catch up with a good friend of the program, Indigenous leader and coalition candidate at the last federal election, Warren Mundine. Good to talk to you, Warren. And I think I plucked from the back of my brain there that you were former mayor of Dubbo too. Tell us about...
I'm glad you gave me a promotion. I was actually deputy mayor.
Oh, right, sorry about that.
But I'll take that. That'll be great.
Oh, yeah. You would have been mayor eventually if you hadn't been pulled away to be the national president of the ALP at one stage. Now, you're in contact with people back there. We spoke to Labor's Senator Deb O'Neill yesterday. She said the situation is very dire. How would you describe what's going on in Dubbo and the rest of the Western Plains area?
Just before we go into that, I just want to give my condolences and prayers to the US military personnel who have been killed and wounded today, as well as the Afghan civilians who have suffered horrifically from that bombing today. And look, for all the veterans out there, we support you, we love you. You've done a great job, and you should be proud of what you have done.
Well said, Warren.
Some of the leadership have done.
Indeed.
Anyway,
they don't choose the leadership. Yeah, no, good points, well made, Warren. Now, just give us your assessment of what's happening out west when it comes to COVID.
Look, I've been talking to a number of people out there. As you mentioned, I was in Dubbo and I was in the council at Dubbo for many years. And look, there's a lot of fear. There's a lot of misinformation out there. I went and looked at the NATCHO, which is the National Aboriginal Health Service body, and you wouldn't believe that only 8% of Indigenous people out there have been vaccinated. It's a dreadful low number of people. There's a lot of chronic and illness and that in these communities right across Western New South Wales and the Northwest. And you're looking at and people being locked up at home, the suffering. From the beginning, it was very pointed out very strongly that we needed to, as a nation, we needed to protect the Aboriginal community in these areas, because if COVID got into them, it would have been a disaster. And I've got to say that up until recently, it's been a good job by the Aboriginal Medical Services and by the various state and federal health services and that. But this is my worst nightmare. Hearing this, hearing the pain and suffering on the phone from people out there, it could be massively disastrous.
Are there enough resources being thrown at it? I know there's a big push to get vaccinations in place, but that'll take a while to kick in. Deb O'Neill was suggesting even an army field hospital so that people could go to a more remote location rather than the Dubbo District Hospital to get tested and treated for COVID.
I've always argued this over many years in regard to the military. We saw the successful medical help and support that we did during the tsunami in Indonesia. We went there immediately, set up hospitals, did things. I always said this would be great training for our military, where that they could go into these communities, set up these mobile hospitals, do the jabs, take care of the community people, the people who are infected, and also make sure that everyone's got a jab before they leave. They're the experts. Our military are brilliant at this. We could get them in there, make it happen, and then move on to another place.
Yeah, of course, dealing with smaller populations there, but they don't have the setups, the numbers of hospitals and mass vaccination clinics and testing sites, of course, that we have in the bigger cities. So you would have thought that some of these ideas would have been considered. Have you taken them up with some of the members of the government?
I definitely am, because I think it's a no-brainer. Because one of the things, if you look, it's bad enough you get sick in Sydney. It's really and it's terrible that you get the virus here. But at least we got the services here. When you start going out into these communities, no matter where you're Aboriginal, black, white, pink, or green, they haven't got those services that we have here. And so we need to get it mobilised quickly and get it out there, because my fear is because of the chronic illnesses and the situation of these communities and the lack of services, there's going to be a massive problem.
Yeah, thanks for joining us, Warren. As we know, when we start to see those numbers, the real problem is coming down the road a week, 2 weeks down the track, so there's time to act.
Yes.
Thanks a lot. Warren Mundine there, as I mentioned, former ALP National President, also former Coalition candidate at the last election. He's also been an advisor to the Coalition government on Indigenous affairs.